Well, our top focus story today is from the UK. Now, the UK strain of the coronavirus has been known to be more contagious. The UK Prime Minister Boris Johnson, however, has announced that it could also be more deadly. The UK is witnessing a record number of deaths from COVID-19 following a surge in cases and hospitalizations since the variant was first identified in September. Virus deaths have risen 16% over the past week, while the number of people hospitalized is almost double the number that was seen during the worst days of the first phase of the pandemic back in April 2020. Now, the chief government scientist in the UK has said that the new variant could in fact be 30 to 40% more deadly for a certain section of age groups, although he's also stressed that this assessment relied on sparse data at the moment. Now, the strain, remember, has spread to more than 60 nations. In India, we have 150 cases of the UK mutant strain. To make sense of all of these developments, we have with us Dr. Veer Pushpak Gupta from the National Health Service. He's joining us from London. Thank you so much, Dr. Gupta, for sparing the time of day and being with us. I have to begin by asking you, this revelation in terms of the UK variant being more deadly, how worrying is this?
Well, thank you for having me on the show. It's quite worrying. We initially thought that it's 70% transmissible, which was what we got from all the studies that were being done. But now we're seeing that it's also more deadly. One of the things that we were reassured about when we heard about the increased transmissibility was that at least it's not more deadly. But now that trend has also been reversed and about 30% more deadly, as you said, in certain age groups. It's important to understand, however, how this data was accumulated. So the increase in mortality is not in patients that are admitted to the hospital. This is a general increase in mortality of the population that is infected with coronavirus, new strain versus the old strain. So I think it's important to understand that the patients that are admitted in hospitals still have the same mortality as before, but it's the community transmission that has become more worrying. And not only is this variant faster spreading, which we saw in the numbers in the United Kingdom, but it's also more deadly. And we had 1,400 cases recently, which is the highest, 1,400 deaths, recently, which is the highest that we've ever had since the start of this pandemic.
Right. Dr. Gupta, the reason why this is not a UK problem. The UK strain, as we know it, has spread to more than 60 countries now. But the question really is, what is the age group that is most susceptible? Who should be worried? Because we know that this strain also spreads rapidly among younger people.
Yes, absolutely. You see, the issue with this strain was that when world travel is going on, when the globalization has happened, people are mixing quite a lot. It's a lot less now than before, but it's being transmitted to other nations quite fast. Within weeks, it was seen in Australia. And I think that that increase in transmissibility led to various countries having it. The United States has reported at least 12 to 17 states within the United States have now gotten the UK strain. But the age group that is most affected, according to the data, is the 60 and above. So the elderly and the more vulnerable population in terms of the mortality. Yes, it's faster spreading in the younger population, but it's not known to be more deadly in the younger population. It's still more deadly in that more vulnerable, older age group, especially those patients that have comorbidities like diabetes, heart disease, high blood pressure. And, as we do more research on this, we will figure out what exactly is causing the death in this particular variant. There's multiple variations of this virus that has been seen, but B.1.1.7, which is the new variant that they're talking about, is the one that has the most number of mutations that can cause an increase in mortality.
Right. And just to, understand how this B.1.1.7, as it's known, is different. One, of course, is that it's more contagious. Now it has been revealed that it's also more deadly. But the other interesting revelation that a lot of experts are in fact talking about is that this mutation essentially changes the way the virus enters the human cells. Can you tell our viewers a little more about that?
Yeah, so the virus has a protein on its outer coating known as the spike protein, and it's just like a spike that attaches on to something. So it attaches on to the ACE receptors in our lung cells, and then it gains entry into the lung cells. And the vaccines, the treatments that we have been trying so far, all target this spike protein. It's the antibodies that we make against the spike protein that prevents the virus from attaching onto the lung cells.
Right.
Now, the mutation that has happened within this spike protein. And there's not been one, but multiple mutations that have happened that allow it to latch onto the lung cells a lot faster than it used to.
Okay.
And that's why we're seeing the increase in transmissibility.
You know, the million-dollar question, are the vaccines that are being used currently effective against the new strain? I think this is the most commonly asked question. And I know, Dr. Gupta, that you yourself have already taken the first shot of the vaccination.
Yes, I had my first shot of the Pfizer vaccine last week in the UK. You know, it's a million-dollar question. Nobody has the answer to that at this point. All the research that is being done, and it's been actively done in the UK and in the US, that shows that there is no evidence that proves that the variant or the vaccine is not effective against this variant. We still have enough evidence to show that the vaccine will be effective, but only time will tell. You know, once we vaccinate enough people and we check their antibodies down the line, we check for reinfection rates, and we check for mortality in about, 6 to 8 months, that's when we'll really know whether the population that has been vaccinated is truly protected against all these different variants or not. 6 million people in the UK have already been vaccinated. They aim to vaccinate up to 15 million by the end of February. And it's a race against time. It's a race against vaccine versus variants.
Right. I have to, before we let you go, I have to ask you, you said that it's still anybody's guess whether the vaccines will be effective against the new variants. The question then is, how is the UK especially coping given the current situation, an unprecedented rise in cases and deaths? Is the healthcare system very overburdened at the moment?
Oh, absolutely. The NHS is a publicly funded healthcare system. It's the largest public healthcare system in the world of its kind, where free healthcare is provided to 70 million people, and it's no doubt about it that it's overwhelmed. Where I work alone, patients numbers have increased. Most of the wards are now COVID wards. ICU numbers have increased, and patient mortality has also gone up.
Right.
So I think definitely the system is overburdened. The doctors, nurses, and all healthcare staff are also undergoing mental and physical fatigue during this time.
A quick comment. India so far has reported 150 cases of the new variant. What's your advice to countries like India to contain the spread of the mutant strain?
It all comes down to effective contact tracing and isolating the strain in the labs, and then finding out, who has it and contact tracing them, and also making sure that they are isolated in an institutionalized facility. I think it all comes down to effective control of the virus by looking at who has it and then isolating them to prevent the further spread. And immigration, travel restrictions, all of these play a role in that.
All right, Dr. Gupta, thanks so much for sparing your time and being with us. One sincerely hopes that the vaccines are effective and countries like India are effective in containing the spread of the mutant strain. Thanks so much for speaking with us.
Thank you for having me. Thank you.
Well, on to the other big story that we're tracking, which is Kerala. Now, while, of course, India's numbers continue to dip, Kerala continues to be a cause of concern. Kerala has been reporting the highest daily COVID-19 cases in the country for days now. The positivity rate, or the percentage of how fast an infection spreads, is 12.48% in Kerala. I'd like to reiterate, the test positivity rate in Kerala is at 12.48%, while the national average of positive cases in India is 1.9% according to the government data. Now, the state government says that COVID-19 cases in Kerala are at a plateau, and the current numbers that Kerala is seeing were not unexpected. The government says, however, that testing and contact tracing in Kerala continues to remain a cause of concern. To talk more about the Kerala story, we have with us Dr. Riju M. John. He is a professor at the Rajagiri College of Social Sciences in Kochi and also a health economist, guest faculty of the IIM Kozhikode. Thank you so much for being with us. I want to begin by asking you, Kerala at one point in time was touted to be the model state. And now we are seeing an unprecedented rise in cases in Kerala, the positivity rate crossing 12%.
Yeah, that's right, Ms. Moribata. Thank you for having me here. Yes, you're right. I mean, the health test positivity rate has gone up to 12.5% yesterday, but that's just a one-day figure. I usually look at a 7-day average figure, which is at 10.9% last 7-day average, as against, of course, 1.8% Indian average. So it's almost 6 times higher than national average, which is a clear cause of concern. And it's pretty clear when you look at the contribution of the state to the national numbers. It's quite worrying in the sense that, if you look at the last 1 week, Kerala alone has contributed to 43% of the new reported cases in the country, whereas the state has only contributed to 7.5% of all the tests done in the country. So there's a huge discrepancy in terms of its relative contribution to the number of cases versus the test. So clearly, the testing is at a very low, and the state needs to increase that quite a bit.
Right. Dr. John, you of course have been crunching the numbers on this. But I mean, when you say it is 6 times higher, you're saying that the 10-day average in Kerala is at 10%, whereas the country's average is at 1.8%. What would you attribute as the major reasons? Because the big cause of concern here is that the testing in Kerala is also between 40,000 to 60,000, whereas the centre says it should be around 1 lakh.
Absolutely, I agree with that. I mean, right now in Kerala, the daily average testing is around 55,000 per day. And, in fact, this is a little bit lower than what it was back in October 1st and 2nd week, when the state was actually having the peak of the pandemic, the initial peak. At that time, the daily testing used to be 61,000 on average per day, and now it's down to 55,000. So, in fact, I believe, having demonstrated that you can reach a certain level of testing, like, you have already shown that you can do 61,000+ daily tests, and why are you not doing that? I mean, you should ideally be increasing it. I agree that daily testing has to go up more than 1 lakh per day, but it's only 55,000 or so. And it has been quite steady at around 55,000 mark for the last more than a month or two now.
Right.
So that has to change, and the daily testing has to rapidly increase and go up more than 1 lakh per day.
All right. So low testing is, of course, a cause of concern.
The low testing, of course, means that, low tracing, and, of course, that the testing is not, there's no substitute for testing as such.
Yes.
So you have to do that, you have to increase it. And of course, the higher test positivity rate, I mean, it's just a mathematical number.
Yes.
You have the number of cases reported divided by the test. So if you have lower test,
right,
obviously it means a higher test positivity rate.
Right.
So there's no substitute to, decreasing that. You have to bring down the test positivity rate, and that means you have to increase the testing much more. And given the high test positivity rate, it would also mean that you are not really finding out a lot of cases, means you're actually missing out, yes, a lot of cases that are out there.
But what according to you, Dr. John, is the reason? Because Kerala was touted to be, the model state, the example that the country should follow. And now it's the other side of the anomaly at a time when we're seeing India's cases dip. One is seeing Kerala stick out like a sore thumb.
Well, it's difficult to say what is the correct reason behind.
Right.
But, I can only speak about the numbers that I see, right? So what I see is that the testing has really not caught up. I mean, the percentage growth in cases is actually higher than the percentage growth in test on a daily basis. So that should not happen. Of course, you're right. I mean, the initial phase of the pandemic, Kerala was touted as the model to follow. But, unfortunately, in recent times, the state could not, cope up with the increasing rate of cases. I mean, and I believe, it's not the state only to be blamed. The state is not the only one to be blamed, of course. Because there has been a lot of heated political activity. We had recently concluded local body elections, which saw a lot of people on the streets. And, now the state election is going to happen in April. And that's also going to see increased, public or people movement across. And, so obviously with these things impending, I see that the cases are not going to go down immediately, but what state can do is to really increase the test much more and as much as possible try to isolate the cases.
All right. So
But then, to be fair, I mean, the state has also been maintaining that, the ventilator capacity and ICU capacity is not being used much, and there's quite a few capacities still remaining. And the state really maintains the position that, the pandemic is under control, even though the numbers looks very large in comparison to what is happening in the rest of the country.
Right. How concerned are you, given the fact that there have been 150 cases of the UK strain being reported in India? We now know that this strain is not just more contagious, but also more deadly. What's your assessment? Do we need to test more positive cases in Kerala, perhaps for the UK strain as well?
Well, in Kerala so far, about, if I remember correctly, a couple of days back, about 10 UK variant cases have been identified in Kerala, only about 10 out of these 150 that you're talking about. So clearly, when you have a higher test positivity rate, that would mean that there are more cases undetected out there. And if, if some of those are these UK strains, which is known to be fast spreading compared to the previous strains that we have, that is a special concern that we have to address.
Right.
So increased testing is the way to go for that. You have to identify as many cases as possible, and that has to happen through increased testing.
All right. So perhaps the only way that Kerala can tide over these times is by ramping up testing and contact tracing, something which a lot of experts have in fact talked about. But thank you so much, Dr. John, for joining us and breaking down and explaining some of those numbers. Kerala at the moment is a state which is seeing a positivity rate which is 6 times higher than India, and we've hoped to sort of break down some of that data for our viewers. Thanks so much for joining us.
Thank you.
Well, with that, we're going to slip into a very short break. But coming up on the other side, Dr. Parikh joins us and he'll be answering your questions on the coronavirus. Stay with us. Welcome back. It's time now to answer your questions on the coronavirus. Dr. Swapnil Parikh, Consultant Internal Medicine, Kasturba Hospital, joins us. Thanks so much for being with us. The first question has been sent by Rohitash Singh Chauhan from Bhopal.
नमस्ते, आई एम रोहिताश सिंह चौहान फ्रॉम भोपाल मध्य प्रदेश। और मेरा सवाल ये है कि वैक्सीन्स के रूप में हमारे देश ने काफ़ी बड़ी सफलता पाई है, बट देश की जगह जगह पर वैक्सीन से रिलेटेड कुछ अफवाहें भी फैल रही हैं। तो मुझे ये पूछना है कि वैक्सीन सिर्फ कोरोना पॉजिटिव लोगों के लिए है या देश के सभी लोगों के लिए?
All right, Dr. Parikh.
So vaccines are for everybody. In fact, they are administered so that people do not become COVID-19 positive. So everybody who falls into the eligible brackets and if a vaccine is available to you should take a vaccine.
All right. So the vaccine is not just for those who've tested positive, but in fact, everybody should go out and take that vaccine. Jyoti from Chennai has sent us the next question.
नमस्ते, मैं ज्योति चेन्नई से। मेरा क्वेश्चन यह है कि यूके का नया स्ट्रेन ज़्यादा खतरनाक माना जा रहा है। अब अगर किसी को अब्रॉड ट्रैवल करना हो तो वह वैक्सीनेशन लेने के बाद ट्रैवल करे या पहले भी जा सकते हैं?
Dr. Parikh, this is a question that a lot of our viewers have actually asked on, whether they should now wait, postpone plans till after they're vaccinated.
I think everybody who can postpone non-essential travel plans should do so. Some people just have to travel, family emergency, work. But everybody who, this is not the time to be traveling if you can avoid it. There are more transmissible variants, and importantly, we don't know that the vaccine will stop transmission. We hope it will stop transmission, but it's also possible that you could get vaccinated and then spread the virus asymptomatically, even if you are protected. And right now, we aren't very sure if all the vaccines will retain sufficient efficacy against the new variants that we are seeing.
Right. So that is, of course, a very important question, that even after you've been vaccinated, you have to take all of the precautions. So avoid travel unless it is absolutely essential. Thanks so much, Dr. Parikh, for joining us and answering all those questions so patiently.